Healthcare has been a huge topic in 2020. We've seen increasing pressures on our health systems all over the world. Innovation in these industries is becoming more important than ever as we try and make treatment more effective, hospitals more efficient, and our systems more agile and, of course, responsive. To debunk some common and uncommon health myths, let's check in with Sean, Professor Sharon Micken from Bond's Healthcare Innovations Program, as well as academic and member of the Gold Coast Skeptics, Paulina Stilic, at the Faculty of Health Sciences and Medicine.
Thanks, Candace, and thank you, team, for all the work you're doing behind the scenes. So I'm really excited, but we got to move quick. I am here in front of the Faculty of Health Science and Medicine, an area where a lot of biomedical science students, health science, exercise students, this is their spot, okay? We have two academics that are actually waiting for us. I'm not going to share their names because it's a bit of a surprise, but I am going to take you a little bit through this building. I got special access today, so come on through. Now, as we come in, what you are going to find, this is actually the best coffee spot on campus, okay? This is a little insider knowledge, all right? But as we walk through, you're going to see a number of study spaces for students, collaboration zones, areas where you can have breakout classrooms, and it's also home to one of the coolest areas on campus, the atrium. And that's actually where we're gonna meet our two academics who are sitting kind of ready to talk with us. Now, my goal is to make sure you're seeing some of the things we're doing here, as well as some of the things students are able to get themselves involved with. So come on with me, and we'll go meet those special academics. Hi, guys.
Hi, Sean, how are you?
Doing very well. Sharon, Polly, thank you so much for having us in the group that we are today. So, today we are kind of in your beautiful facility, so thank you for having us, like I said. But I think what we're kind of here to talk to you about is kind of maybe the current pandemic a little bit, and maybe, I mean, we are in healthcare, and that where I was kind of going is I wanted to see from you specifically, Polly, you were involved in the Gold Coast Skeptics. It's an organization, I'll let you speak about it because I don't know enough, but one, I just kind of wanted to hear what that is about.
Yeah, so I'm the president of a local skeptics group called the Gold Coast Skeptics. And basically we try and promote science and critical thinking to the public. And we predominantly do this with monthly meetups, and we podcast all of our talks to allow it to access a wider audience to access the information.
Awesome. So I guess directly with that, so why is, I guess, misinformation particularly dangerous in a pandemic?
Yeah. So misinformation has been around always.
Of course.
And one of the things about the dangers in a pandemic, because it's such a new situation, is that the science itself is evolving.
Yeah.
And that can create a little bit of confusion, but that's because science is trying to do what science does best, and it's self-correcting, and that's absolutely normal. So in all that confusion, what can happen is that misinformation can come about, and it's actually a lot easier to spread misinformation during a time like a pandemic. A really good example of this is in the spread of some rumours and misinformation around prevention. If you drink hot water or alcohol or methanol or bleach or, disinfectant, it'll stop you from getting it. This is not only not true, it in itself is really dangerous.
What's really cool, I think that space is so important, and even some of the things you brought up, I think are things I honestly sit here and I don't know that I knew, and so I appreciate you kind of sharing that with us. I will transition kind of over to you, Sharon, and you are kind of one of the lead individuals who helped create the first Masters of Healthcare Innovation program. Why is innovation on the back of this so important at this point, moving forward?
Okay, so innovation is really crucial for healthcare as an industry.
Yeah.
Healthcare is very complex, and at the moment we've got sort of three trends of increasing activity. So we've got increasing costs getting out of control across the world. We're all living longer, and we're therefore using more healthcare and expecting more healthcare to keep us alive, healthier for longer. And I think technology is also giving us a whole lot of options, and some really great options. So as a consequence, the healthcare system can't just keep building and increasing And we need some innovation to kind of really focus that down to what do healthcare users need and how do we provide it.
Just a bit of a left turn. Do you find that there is a certain type of student or person that actually it comes after this, or is in their heart, or can you speak to that a little?
Yeah, because I think what we're doing with our program, we're co-teaching with our research colleagues from the Institute of Evidence-Based Healthcare and also with business academics from the business school.
Okay.
And so what we're saying is that you need to understand the research evidence to know what works. But we also need to understand how people work and how people think and how organizations and systems work. So I think really the people that we're targeting is people who've got a career in healthcare. You kind of, you know what you're doing, but you're wanting a new challenge.
Yeah.
You're also possibly thinking that, I don't really want to do a PhD, but I want to do something else.
Yeah.
And so this program's in the middle because it actually gives you a different way to look at the work that you're currently doing. And it also gives you a chance to learn with and about some of those aspects of innovation so that potentially you can start innovating in your own practice, just improving. Not all innovations are about super tech and super cool, but some of the innovations in healthcare just are about being really respectful of patients and understanding and meeting their needs and actually improving the way services are delivered.
I don't feel like I'm an innovator. I feel like I'm going to walk away from this table wanting to go change and innovate. I think the passion of both of you kind of comes through in the way you speak. And I appreciate both of you for taking the time to kind of go through what you do and the work you're doing out there. So thank you both very much.
Well, it can be fun to learn about innovation and get involved in innovation.
Absolutely. And it's exciting. It's still fun for you.